Yeah.
Oh,
That's pretty good for me. Starla's Noel's friend, so everybody else that works with us, so we can go
Great
around if
group.
you want
I'm so
to.
excited.
Yeah.
Third time. So today we're going to talk about inflammation. I'm sure there's buzzwords around it. How many of you have heard of inflammation? How many of you are very familiar with and or know what inflammation is exactly?
Not
Okay.
exactly.
Okay. So it's kind of like gluten-free. We've heard about it, but we're not sure what it is, right? So we're basically going to get into inflammation both in acute and chronic phases. Acute is short-lived, chronic is long-term, and the effects of both. And in some cases, it can be a good thing. We need inflammation to heal. Thank you. We need inflammation to create cellular turnover and things like that. But when it gets out of hand or to the extent where it becomes chronic, weeks, months go by, it actually degrades tissues. So what does that look like, and how is that affecting you? So I have to do tandem. One is audio recording for YouTube, and one is presenting for you. So the word inflammation is derived from the Latin word meaning fire. Okay? So it's setting on fire. What happens when you bump your knee? It gets red, it gets warm, it gets inflamed, right? Swollen, painful, things like that. So what does it involve? Can you see? Mm-hmm. So first it triggers the immune system. Vascular system is more blood flow, okay? That's the inner highway in our body. How our body communicates with each other is through the vascular system. Hormones travel through blood. Lymph travels through blood. Nutrients, oxygen, all travel through blood. So that's our highway system, right? Local cell signaling, okay? They're kind of talking to each other, hey, I have a bruise here, I've been damaged here. And then it's kind of like this telephone game. They tell their neighbor tells their neighbor, and before you know it, the brain gets signaled and knows how to send things, healing cells and things like that, through these other systems in order to start working on it, cleaning it up, and laying down new tissue. Does that make sense? Digestive tract. The number one way that we absorb nutrients in order to go down this highway to signal these two to rebuild is through digestion, right? Foods we eat can be pro-inflammatory. Sugars, caffeines, glutens, dairies, all of those things. If you were at our buzzword speech for the Lunch and Learn, then you know a lot about those words and what they mean and how they can affect our health. So we're going to talk a little bit about acute versus chronic, okay? So there's a few different mechanisms at play here. You can see that acute is a lot more straightforward. Starts with a stimuli. I banged my knee. Okay, I hit the table. The immune helper cells start doing their job. We need to heal. Then the end stimulus are healing. Collagen rebuilds the cells. It lays down new tissue, sometimes a little too much, creating scar tissue, depending on how deep and bad the wound is, right? In chronic, the feedback loop never stops. This end result never happens, okay? Instead, it skips this part and goes straight back into the stimulus, overacting the immune system, degrading our ability to digest and absorb things. It's basically creating, oh, it's okay. That's going to be recording. So it's basically creating a repetitive cycle that increases our ability to, decreases our ability to heal and increases our chances of disease states. Okay? Because the way I think of it and the way I describe it to patients is think of a cup. Some people are born with a thimble-sized cup. Some people are born with a big gulp. You know, I smoked a pack a day and ate a steak a day and lived to be 102. And, you know, I took one medication and my body fell apart. You know, that's the thimble, right? So inflammation, your body fills this cup up every day. Pollutants in the air, foods we eat, our stressful states we talked about last week in the mind-body, how that releases cortisol and adrenaline when we're in a stressful state and that causes damage. So every day we're collecting or filling up our cup. So are we doing anything to empty the cup out to get ready for the following day's inflammation fill up, okay? And a lot of times that cup never gets empty. So what happens, it overflows and it leads to more disease. A lot of times in women we see it in endocrine issues, PMS, menopause, perimenopause symptoms. We see it in migraines and headaches, a lot of skin rashes, acne, eczema, psoriasis, digestive disorders, constipation, diarrhea, bloating, nausea, vomiting. A lot of those issues affect women, especially heart disease. We develop gallstones. We're more likely than men to develop those things. So those are things that those are signals. Doesn't mean your body's broken. Doesn't mean there's anything wrong with your body. It means it's doing its job and it's trying to communicate to you, please do good things for me to help clear that cup out because I'm too full, okay? And that messenger is inflammation. It's the number one way our body wants to communicate. That causes pain, discomfort, and what we're taught usually is it's inflamed, take an anti-inflammatory. I have a fever, take an anti-febrile. I have, anything that goes on, there's an anti-drug for it. So we basically tell our bodies to shut up because I know better. All of those things, antacid. It's like undoing what the issue is rather than really digging a little deeper and kind of saying, what's my body trying to say to me? What's this translation? And if I don't have the skill set to understand, I need to seek the guidance of others who can. I tell patients all the time, I just happened to use a lot of time and money to learn this language. That's really all it is. And it's my job to help you translate your own body's language. Because everybody's speaking a similar biological language, but at the same time, it's very unique to each of you. What I can eat, you might not be able to eat, right? I can't stay out in the sun as long as maybe you can. Things like that, right? So those are all things to consider when we're talking about inflammation and what it leads to in the body. So there are 5 stages of inflammation. So again, a lot of people try to memorize, but if you really think of it logically, think about what happens when you bang your knee on something. If you have a zit and you pop it, like any of those things. So first it's going to get red, right? Blood is rushing to the area. That's that vascular that we talked about, the blood flow. Then it's going to swell. It's going to increase in volume because we need more helper cells in the area than we did before because there's damage. So it gets slightly larger, but that's a good sign, okay? Then, I just wanted to make sure it lined up right. Then we feel pain. And these usually happen very close together, very, very close together. Sometimes within minutes, sometimes within hours or days. It just depends on the type of inflammation that's happening, okay? After we feel pain, it gets warm, right? The sensation, if we felt away from where we bumped versus where we bumped, it would be very, very warm. By increasing temperature in the area, we're dilating all those vessels so more cells can fit through that pathway or on that highway. So it's like going from a normal 2-lane highway, now it's an 8-lane highway because we need to get as much traffic to the area as possible. Does that make sense? Okay. So then last but not least is loss of function. If I banged my knee, the next day I might have a little bit of a limp. I can't function as well as I did the day before I had that trauma, right? Just like with digestive inflammation. You can't really eat the same foods. Hangovers, your liver's inflamed. You can't really process as much alcohol. Does that make sense that over time things like that are going to be affected when inflammation is at play? So it's considered a part of our innate immunity, and it protects us from pathogen invasion. So we always have a small amount of inflammation that's healthy for us because we're breathing in the air, especially in the dust bowl that's Phoenix, right? There are things constantly crossing our immune boundary. And so what is our body doing? It has to utilize nutrients from what we eat, fresh water from what we drink, and that feeds and absorbs into the gut, goes through the vascular and immune system, and helps empty that cup out. But how quick are you filling the cup? So those are the important things to remember. So with acute inflammation, 0 to 3 days, that's when, this is all sciencey and technical, so we won't get totally into it, but clot formation, that's fancy word for scab. You cut yourself, you scab, right? You have to first. Cuts off the blood, your blood clots. Cell activation, growth factors. It's starting to clean out the bad stuff so that it can make room to lay down the good stuff, okay? Usually 0 to 3 days, depending on the person. So if you get a cut, let's say, within 0 to 3 days, that's what's happening. From day 3 to 12, all of this is happening. Granulation, tissue forming, collagen deposition, basically just means new stuff is being laid down in the area, okay? So it's like demolishing the house, taking out all of the things, the lumber and the cement and everything that got broken, and now we're pouring a new slab. We're building new walls, okay? That's what is happening here. Then we have 3 days to 6 months, depending on the level of damage. Sometimes you bang your knee and 4 days later it's fine. Other times you have a major deep cut and you can still feel it for months, or a scar, right? That slowly, this part happens almost instantaneously, but you still have a bright pink scar in the area, and over 6 months it slowly fades to be more flesh toned. So that's what's happening here, okay? So not as much rebuilding, we're just kind of putting the finishing touches on everything and making it look nicer. Makes sense. Okay, any questions so far?
So, like, there's some that take years too, though, right?
Depending on the person, if it takes years to heal from inflammation or damage, that's a sign of chronic inflammation or degradation. Your cup has been way too full for way too long, because it shouldn't really take a year to heal from an acute inflammatory response. Because again, we have the short term, the acute, and the long term or the chronic.
Is that why somebody that has diabetes and has, like, they end up with an amputated toe or something, there's no healing? Is that kind of the same?
It's very similar, but that has more to do with dysregulation of blood sugar and how it affects our nerve transduction, and so we get neuropathy and diabetes. My foot constantly feels like it's falling asleep, nothing's being sent to the area, and eventually I need to have it amputated. Okay, so there's definitely inflammation in that process, but it's an endocrinology, it's a pancreatic and insulin response paired with inflammation. So inflammation is kind of like the tag-along friend, and any issue we're having, it's usually right there behind it. So it's kind of all playing together on the same team to create problems and or healing. If it's acute, you bang your knee, you want inflammation to heal. You want that new skin to be there 2 weeks later so you can get your mobility back and keep going on with your life, right? It's when it turns chronic is when we're noticing the problems. So what happens if the acute inflammatory process is stunted? So ever since this injury, I can't move this shoulder quite right. That's because your acute process got stunted. But why? Why does that happen? Okay? It can lead to chronic pain if you have continual re-injury. People who, like I'll see, I have construction worker, waitresses, people who do the same motions every day. Okay, well this never heals. Well, it hurts when I do this, so don't do that. Give your body a chance to heal, right? It's the same thing. Anytime we have mechanical issues we're doing over and over again, we're degrading those areas that are being worked because we're not giving enough rotation to our body in terms of movements, right? So if I'm doing this all day, then I need to do something to undo that pattern at the end of the day, okay, to help avoid the stunting process and give the body a chance to catch up or empty out its cup. That makes sense. So again, we experience decreased function, biomechanical changes, things like bone spurs, tendonitis. If your body's constantly having to lay down new bone in an area, we have bone spurs in our heels and our knees and our back, and I have so much pain. Well, your body is trying to do its job, but what are you doing to support that? Are you taking a lot of anti-inflammatories? Are you still doing the same terrible position and posture and aggravating that area? Because by taking those NSAIDs, you're basically saying, I know better, you don't know what you're doing, body. It has this innate ability to heal, and we're stifling that, right? Stunting the process, stopping it in that middle step, so it never gets to that end step, which again creates that feedback loop, which leads to chronic inflammation, and that's where the disease happens. So, tends to be really low grade. When you first have an injury, it can be debilitating in a sense. I hurt my shoulder, I couldn't move it for 6 weeks. And now I can move it and it's fine, but I hear this click. Or it's not quite the same as it was before. I have about 70 or 80% function, right? So it's not necessarily all the time, in some cases it is, but not all the time is it preventing our quality of life. But we're just not where we were before. Again, that turnover never quite happened, okay? So the effects are more insidious and long-term, and sometimes can be harder to undo. It's very possible, but the earlier we catch it, the more time and the more things we have to be able to undo it. So I just want to take a quick second to look at those symptoms. And just note to yourself how many you have. We're going to do an intake in a second. We'll do the checklist in just a minute, but just kind of get those wheels turning. Dark circles, diarrhea, cramping, rashes or hives, memory fatigue problems, Cough or sore throat consistently, change in appetite. It says loss, but change can be a sign. Fever, chills, headaches. If you feel puffy, swollen, any of those things are all signs of chronic inflammation. And then those are some remedies that we tend to give our patients in order to help clear it, right? These are things that fill the cup. These are things that clear the cup out. Give you
No microwave. Interesting.
Mm-hmm.
Why, does it seem to kill something that you need in the food that you're getting, or is it?
Oh, definitely. Definitely. I mean, if you've had anything microwaved, and I mean, bread, it gets that weird consistency and then turns rock hard 30 seconds later. What is it doing to those molecules, right? The only thing that's actually safe to microwave is water. And that's because of its polarity and a whole bunch of other chemistry stuff. But it changes the chemistry of your foods. It degrades the nutrients. So every time I just want to nuke it real quick, make it warm, you're basically just losing all of the nutritional content of that food. So
Those bags of steamed vegetables that you put in the microwave.
Really?
it's just fiber. It's not nutrients or antioxidants or anything that's alive that's going to clear the cup out. It'll help you have normal bowel movements probably, but outside of that,
And so it takes away everything but the fiber, basically, you're saying?
yeah, anytime you nuke anything, unfortunately. Like I haven't used a microwave in 10 years. I have a toaster oven, and it causes a lot more patience, but I definitely notice a difference with my digestion. But I have a hypersensitive digestive tract, or I did at the time, so for me it really helped. Some people can totally stand it. I have my roommate, he's a 27-year-old guy who nukes everything, and he can't tell a difference. But I guarantee you, if he removed it from his diet and stopped using it, he would notice benefits, right? But we get comfortable with our discomfort. So although there's no major symptom knocking at his door, that doesn't mean he's not suffering on some level. So what diseases are associated with chronic inflammation? So these are diseases that we know for sure based on clinical research, okay? All of these issues. And I underline the ones that, in most cases in women's health, since we're talking about women's health primarily and how it affects us, those are the ones I see cross my patient threshold the most. So women, I can't lose weight. I just can't lose weight. Well, what are you eating? Well, what I've always eaten. Okay, but you've filled that cup up over time so much and aren't doing anything to clear it out that it has to go somewhere. It's degrading our epithelial lining in the gut. It's preventing our ability to absorb healthy nutrients. So stuff is building up, causing weight gain. And then when we can't absorb the nutrients we need, we don't get the cofactors to our thyroid and our ovaries and all these great glands that we need to have healthy metabolism and healthy energy and healthy weight. We need B6, B12, magnesium, niacin, all of these things that aren't really getting into the bloodstream. A, because we're not eating foods high in them, and B, if we are, they're not being absorbed because we're too inflamed to have it get in, for lack of a better, and we'll see that too. I'll show you the epithelium. Does anybody have any of these? Suffered from them, either yourself or know anyone? A lot of hands, okay. So chances are you have inflammation, acute leading into chronic right now, which is fine because we're gonna talk about ways to undo it, which is good. So here's another visual for inflammation. A lot of times can be a precipitating factor to a lot of these issues, pulmonary diseases, cancers, cardiovascular, again, because with inflammation, the vascular system and the immune system is in that pathway. So of course the immune system is going to be degraded. Of course the vascular system is going to be degraded. Alzheimer's, the myelin sheath of the neurons is being degraded because of inflammation. Pancreas isn't working right, so diabetes too. We're not making insulin. So what causes it? The number one thing that I see is our diet. Diet, diet, diet. I grab and go. I'm hungry at the end of the day. I just want to make something easy. I just want to pop it in here. I just want it to be convenience, convenience, convenience. So we're putting convenience before health. And it's not on purpose. It's just because we're not as educated as we'd like to be in this area, right? So pro-inflammatory foods. Dairy, one of the highest pro-inflammatory foods. 77% of Americans are lactose intolerant and don't know it. Gluten. The way that they raise the wheat. This isn't this big thing, oh, I'm gluten sensitive because it's a fad. It's because the way they farmed wheat has actually changed. Pesticides, herbicides, turnover of crop turnover creates more nutrients in soil, and they're not doing that. They're mono farming, which means it's one crop all day, every day for years and years and years. It's leaching the soil of specific nutrients, leading to the wheat being digested differently and causing a gluten sensitivity. Sugar. How many people are addicted to sugar? Yep. So sugar is very pro-inflammatory. It's actually known to bind to the same receptors in the mind as cocaine.
And that's hidden too in all these things.
Everything. Fat-free especially, they have to add the sugar to make it taste good because, right? And it releases dopamine in our brain. Dopamine is our reward system. We're happy. We did good. I am a good person because I just had a Snickers. Like that, it sounds silly, but that is the biology, the biochemistry that's happening inside of us. And we're just on this autopilot of to-do lists and have-tos, and that before we know it, we take a step back and look up and we're like, who's this person in the mirror? And my clothes aren't fitting and I feel like crap all day and I'm stressed out and I'm no longer happy in my relationships. When did that happen? It's been happening. That whole time our head was down doing all these other things that took precedence. And now, I was saying this before in the Lunch and Learn, we're used up and we can't even enjoy our retirement because we're sick and tired of being sick and tired.
Well, on your one list you showed being hot or being cold is too much refined sugars. Is that on there?
Well, because refined sugars has been linked to metabolic issues.
When you say refined, is that like high fructose corn syrup or these pretend sugars?
Well, high fructose corn syrup, bleached sugar, because in its natural state, raw sugar is brown and it's got larger grains to it.
Yeah.
And so the closest to nature we can get, honey, maple syrup, things like that, that is unrefined sugar. Versus refined has been through the bleaching process, ground down multiple times in a plant.
So granules sugar.
Exactly. So I use coconut sugar, organic raw sugar, because I still eat sugar, but I eat it in very small amounts, and I eat a higher quality. So
Like with olive oil, they say to get the extra virgin olive oil.
exactly. And cold pressed coconut oil, and again, when oils and things like that are exposed to heat, they can go rancid and their nutritional value is no more. They're just a fat at that point. They don't have any of the anti-inflammatory effects.
I heard that olive oil you don't want to use in
You
a meal.
never cook with olive oil.
Just like in
Only
salads,
dressings,
cold.
only cold. Yep,
I heard
because
that'd be really bad for you.
it turns into a carcinogen, and carcinogen is what turns on cancer cells. It is cancer promoting. So everybody thinks they're being healthy, sauteing with olive oil, and I'd rather you saute with butter. Has a higher smoke point. But coconut oil tends to be the best.
It's
Mhm.
a really good fat for us, right?
So olive oil is a great fat. It just has such a low smoke point that if it's exposed to any heat, it starts to degrade and become carcinogenic, causing that problem.
Yeah, I just learned about it a couple months ago. We switched to coconut spray versus the olive oil spray.
It's-
We
yeah.
thought we were being healthy too.
Yeah, and that's the thing, is like kind of wading through the information. What's good, what's real, what's not.
How's avocado oil?
Avocado is mid. So if you do a light saute or bake with it, but not like, you can't sear with it. So what's really cool is you can go on Wikipedia and look up smoke points, and it gives you a list of probably 200 oils and the degree in which you can heat it to, and preferentially how you should ingest it to get the maximum nutritional value. So that's kind of what I went off of. I love Wikipedia for stuff like that. It's all there for you. So refined carbohydrates that spike the blood sugar, white breads, most things that are baked, unfortunately. Again, refined, they strip any and all natural nutritional value out of it and make it easy and on the go. Granola bars in most cases, they've been processed and packaged and extra sugar added and refined and down to the point where it's just empty glucose, really. Food additives. Red dye number 6, yellow dye number 12, blue dye number 42 to make Gatorade this pretty purple color. Yeah, those are all very pro-inflammatory. Some are more than others, and it depends on the person. Some people I know for a fact cannot have those additives at all, or others, can deal with a little bit more. Again, they have a bigger cup maybe before it gets full.
Cherries probably have a red food coloring
What types of
in it.
cherries?
Little cocktail cherries.
Oh, maraschino?
Heavy
That's-
with food color.
Oh yeah,
Oh, man.
saturated and refined sugar.
Yeah.
It's in a sugar. It's in a sugar syrup. Mm-hmm.
I used to get those at Costco, the big jar of them.
Oh, I used to drink the juice when I was younger.
Right.
Like we would.
Yeah.
It was, yeah, I mean, you don't know until, you seek that information out. So food sensitivity is also cause inflammation. If you know for a fact, every time I eat, fill in the blank, I get a stomach ache, but I love the taste, you're causing GI level inflammation every time, But it tastes so good. Okay, well, maybe moderation, maybe not a daily or a weekly, but like once or twice a year. If you know that, I'm not the food police. I don't want you to not have birthday cake and ice cream, but, it shouldn't be that daily reward system. Oh, I have that 2:30 feeling, and the only way I know how to get out of it is to have a cup of coffee with extra sugar and cream, or a candy bar, or some hard candies, or a donut, or whatnot, Walk around the block, get blood flow, get oxygen to the brain, move your body, move your pelvis. I was like, I'm tired. She's like, do you want coffee? And part of me was like, yes. The other part's like, just do jumping jacks, move around, get the circulation up, because that'll wake you up just as much. And it'll release endorphins, which make you feel great. So sleep deprivation, if you don't get at least 7 to 9 hours and wake feeling refreshed, it's definitely causing inflammation, because what happens when we sleep, that's the most parasympathetic. Remember we talked about the fight or flight sympathetic, and then the parasympathetic rest and digest. That is the one time we give ourselves every day to empty the cup. So if we're not getting good quality sleep, we're not getting deep sleep, and we're not getting long enough sleep, our body can't undo all the damage that's happened that day. So it just carries over to the next day. Chronic stress. How many people here suffer from chronic stress? Right? Again, we talked about that last week with the mind, body, cortisol, adrenaline, all of those stress hormones being released, causing inflammation, right? Our body, again, filling up the cup, not emptying it. And chronic infections. I have patients who say, I love my dog, but I just constantly have hives because I think I'm allergic. Or, I live in a place that I love the scenery, but I just have allergies 10 out of 12 months a year, right? Those are things that are putting our body in a constant state of inflammation. And those are things we really need to look at shifting. Because if we live in this dust bowl, and it's, how many patients have I had? Ever since I moved here. Well, don't live here. I know that's kind of a hard thing to swallow, but either move outside of the ranges so that you're not in the dust bowl if it's really affecting you, or do things double duty to help undo all that damage you're doing every day. But some things got to give. Because if you're having problems ever since you moved here, the problems aren't going to go away. Again, it's the whole, this hurts. Okay, so don't do that. Ever since I moved here. Okay, well then don't live here, Easier said than done, I understand. But if there are things we can do to work around it, then we do. So hypersensitivity reactions. These are basically the levels at which our body creates inflammation. And I really wanted to focus on level 3, IgG. The way I remember inflammation is you have IgA, which is not listed here, but I remember it as a chew. IgA is sinus, it's histamine, it's allergies, pollen, dander, dust. IgE, emergency room, my throat is closing up. Peanuts, bee stings, wasp stings, like.
Latex.
She has a latex allergy.
Yeah, so
Yeah.
exactly, and that's an IgE.
Scary.
You have to go to the hospital, you need emergency intervention. Then we have IgG, or gut. Okay, that's at the level of, I have eaten the same breakfast every day for 30 years, and I love it. Well, let's do a lab panel and see. She ate a banana every day, found out it was one of the highest on her allergy panel.
Really?
She's producing an inflammatory response. It's like banging your knee in the same place every day. At some point, her body was like, enough banana. But she didn't get that message, so she just kept doing it. You could totally eat bananas and be fine, but for her specific biology, it wasn't reacting the way it needed to, and her body was actually creating an immune response, an antibody response, saying, this is basically a bacteria or a virus, and I need to fight it. But she's like, but it's got potassium, and
Yeah,
right?
It work for
Uh-huh.
everyone. It's gotta be good, right?
So, and that's that kind of bringing it back to naturopathic medicine that we talked about week 1, is everybody is generally the same, but still very unique. So, generally speaking, fruits and vegetables are good, but what if there's one or two that's specific to each of you that isn't good? And how can we find that out? There are tests to do for things like that. So it's good to know that you have options out there if that's something you wanted to do and find out specific to you. You could always do an elimination diet too. Take out anything that you think could be causing problems, super clean diet for 1 to 2 weeks, and then introduce and eat it 3 days in a row and say, wow, I got this weird rash and I don't know what's going on. Well, what changed? That one food. And so that's an easier, takes a lot longer, but it's a cheaper and more personal way to find out what you're allergic to in terms of your body creating this level of an inflammatory response.
What's a clean diet?
Yeah, exactly.
Removing refined sugars, dairy, gluten, most meats, unfortunately, because of hormones. Eating all organic because of the herbicides and pesticides. Avoiding legumes because they tend to be out of plants the highest in terms of allergic. So peanuts, even nightshades are really high on the list. So beans and tomatoes. I have an elimination diet if anybody wants it.
Yeah, that's interesting.
Yeah, so I can totally bring that handout. Mm-hmm.
And the test to have lumpids done instead of? What
It's a
does that-
blood draw I do in office, or I'm sure around the community there are a lot of physicians who offer it. Blood draw, spin down the blood, take the serum, mail it off. 2 weeks later, you get the master list of everything that you're allergic to. So, for instance, with Gail, testing 115 foods, came back, do you remember your number? 20? I think it was in the high 20s. Anything over about 20 lets me know it's leaky gut. You've degraded the epithelium so much that there aren't any gap junctions in your cells. They've kind of deteriorated to the point where everything's just kind of getting through and going straight out the back chute versus being absorbed. Every clinic and every person is different. There are 7 different labs in the area that I know of that do them off the top of my head. I personally work with Immunolabs. It comes with trackers, guides, DVDs on how to eat, how to shop, your results both on a full printout and on a wallet-sized card, so when you go to restaurants or the grocery store, you can just kind of pull it out, read labels, and see, does it have what I'm allergic to? And then it also comes with, which I think is really great, a nutritionist. It's out of Florida, so you have to account for the time difference, but she makes all of your plans. You say, hey, this is my account number, these were my results, here's a 30-day specific to you, day-to-day meal plan on what to eat and how to rotate. And depending on the lab, I do that full package that I just talked about because I feel like it's more comprehensive. And if I did just the printout, you're going to have to come in for those meal plans. You're going to have to come in for that treatment and pay the office visit anyway. So one can run anywhere from $175 to $275. The full shebang can run anywhere from $350 to $550, depending on the lab. And unfortunately, most insurances don't cover it. So that's the only drawback of that test. But again, you know specifically to your biology what to eat and what not to eat. So you're that much more ahead of the game. It was.
Somewhat. Yeah, it was covered, yeah.
So you got
much of it, I got a reimbursement check and I gotta see. what
Do you
the
know how much it
difference is
was?
gonna be.
Do you remember?
Check, no, I didn't get my final bill on it yet, cause I just got the Spectracell one.
Okay.
I just got that in, so. I got that
Spectracell is
back.
definitely covered. That's micronutrient testing. They actually go into your cells specifically and say your cell is not making enough vitamin D, enough calcium, and you don't have enough vitamin C. And so it tests hundreds of micronutrients and will come back and tell you what you're deficient on. So now we know, when I do these tests, we know what foods to eat and what not to eat. And we know what foods to focus on because we know what micronutrients you're not getting. So how do we give you more vitamin C? Supplement, eat more oranges, get an IV, you know what I mean? So that gives me a better idea as a physician who you are specifically, biologically and biochemically speaking, and then it's a better intel on how to treat. Because I could kind of throw everything at you and see what sticks, but I mean, time and money and energy and frustration, and if something gets worse before it gets better, and I'd like to avoid all of that if possible. But the elimination diet can take 3 to 6 months, depending on how many foods you're removing and then replacing, where the food allergy costs more up front, but it's more instantaneous and more thorough.
Do you know ahead of time everything that they're testing for?
Yeah.
And if there's something that I say if I thought, oh, if I think I might be allergic to this and it's not on that list, can they still look for it, or is it pretty comprehensive and it should be on there?
There are levels, okay? So there's a basic panel of 88 foods, the standard panel of 115, and you can go full-blown comprehensive 154 foods. I mean, there are mung beans on there. I don't know about you, but who eats mung beans?
Chinese food.
Oh, okay. So yeah, so you do. You can also do what are called assays, which are add-ons. So let's say we wanted to do right in the middle ground. We wanted to do 115 foods. It has coffee, sugar, chocolate, all the main things on there that we'd want to test. But you say, I kind of have a suspicion that eggs I'm allergic to, so instead of just testing eggs, which are on the list, I do what's called an assay, and I look for albumin, which is the protein in eggs. Is it egg whites? Is it egg yolks? Is it goose eggs? Is it duck eggs? Is it chicken eggs? So then we can look down specifically onto, exploring more into eggs. If you think it's gluten, okay, so let's look at gliadin. And at what level is that gliadin, right? If it's milk, is it casein? Is it whey? Is it the protein? Is it the, different aspects of dairy? And so we can go as far down the rabbit hole as you want to go, or we can kind of be as general as you want to be.
I think what you're saying is so important because we're in the mindset of if we're told it's healthy, then we can eat a lot of it. Like kale is supposedly so healthy. I was buying it, made my husband's platelet numbers go up 300,000 in a month. And I found out that's not good for him.
Not for
So
him,
that's
yeah.
good. But I would have never thought of it. Because
And
it's so good.
Exactly, and that's why, for me anyway, because I did want to be an MD for the longest time, but the more research I did, I found out that naturopathic, the thing that makes it so unique is it's the individual. We treat you as who you are. We're not going to just throw a drug because it's worked for 700 people before. What if you're the 701st and you're the outlier that it doesn't work for? Same with foods, same with botanicals and treatments and approaches, and so everybody really is so unique. And these types of tests that are specific to you versus, well, let's just look at your lipids. Okay, you're good. But what if for you, you need more fat in your diet or less fat? So you're within normal range, but that's not good for you or your genetics or what you need.
Yeah.
So, yeah.
And like a lot of doctors, like my main doctor's internal medicine, well, she doesn't seem to know a lot about food and nutrition. So it's always a
Yeah.
or something.
If you want to go on YouTube and look at week 1, we talk about the side-by-side, what an MD learns in terms of their educational background and what I learn, and they don't have any credits required for nutrition where we have to take 12 to 16. So it's required, and we do it in tandem with our biochemistry, so we know how our nutrition affects biochemistry. And then gastroenterology, how does that affect our GI system or our major level of absorption? So, we're definitely schooled differently. They know a lot more about pharmacology, and they can kind of totally have that, in my mind. But yeah, nutrition is one of the things we focus on because then we can integrate. And hey, I tried all the lifestyle nutrition stuff, and we made this much progress, but we still need a little more. Okay, well, let's turn it over to an MD because what if there is a medication that's essential? So it's the two that symbiotically work together to get you well. It's kind of two sides to the same coin in my mind in terms of healthcare. So, any more questions on food allergies? Okay. So, again, this was kind of a lot of the things on the list. Hashimoto's thyroiditis, the reason why I highlighted that is because, again, I get a lot of that. If you have hypothyroid, too much to the point where your body starts attacking your own thyroid, that's what Hashimoto's is. And that's probably one of the biggest things I see outside of lupus and arthritis.
So with Hashimoto's, are you able to work with people to reduce their medication or get them off medication, or do they still need medication?
They won't ever get off, unfortunately, but I've significantly reduced a lot of patients' thyroid meds.
Gluten-free is.
Exactly. Gluten is very pro-inflammatory and worsens Hashimoto's. That's probably the number one thing I see that affects it is gluten. The next would be dairy, and then the next would be meat. Just the hormones in meat can throw off our endocrinology balance and affect it. But she is on a minuscule amount of thyroid med because your body at some point stops making its own. So, unless there's a food that can turn on thyroid hormone, which it supports the production of, but it doesn't mimic. If that makes sense. So, Inflammation in the gut. It's estimated, based on research, 80 to 90% of the immune system is in our GI tract. Immune cells, even serotonin, right, the happy, healthy, reward hormone, a lot of things are absorbed and secreted by the GI. So if something's wrong at this level, we're going to notice everything else. So people come in and say, I have these 5 seemingly unrelated symptoms, and I don't know what to do. I always start at the gut level, and honestly, 9 times out of 10, most of those symptoms will clear up. So inflammation in the gut is linked to the inflammation throughout the body because, again, that is where it gets into the bloodstream. That's the level of absorption, right? And then it kind of can say, okay, you're something we don't need to absorb, so you go out the back end. You're something we need to absorb, so you're going to go into the vasculature and the immune system and up to the brain and all the places we need to feed, okay? And if things aren't being regulated correctly and there's an inflammation response, all those inflammation cells that have gathered there are going to be sent everywhere else down your highway or your vasculature. So factors in gut inflammation. The lining of your gut is affected, your flora, which is probiotics, right? You need healthy flora to break things down. You just do. Antibiotics kill them. They kill the bad biotics, like bacteria and all of those things, but it also kills the good bacteria that we need to build up our immune system to help with absorption and regulation of bowel movements. Also, food or chemicals that are ingested, they're all going to affect. And if you have an inflammatory reaction that's already happening, if you have an autoimmune already, if you have a hemolytic or blood issue, if you have joint problems, that's constantly creating inflammation, recirculating, guess where it's getting deposited or being affected is at that level. So here's a great picture of epithelial lining. This is a healthy gut cell. So you can see arterial blood is the red, venous blood is the blue. These little cells are epithelium cells. They are the guys who get to say what comes in and what stays out. If you're bad, you keep moving along till you get out the other end. If you're good, you can go through this junction into my blood, back into major circulation. That's how it functions well. If we're eating bananas every day and we have an inflammatory response to bananas, guess what happens after a year or 2 years? Slowly but surely, right? The redness, those stages of inflammation we were talking about, stage 1, 2, 3, 4, 5, loss of function. Doesn't work anymore. Those cells, everything that our body is trying to kick out gets reabsorbed into the bloodstream, making us sicker, fatter, and more tired, more in pain. So this is what, and even if this happens, we can get back here. That's the good news. I don't want to scare tactic anyone. You're gonna die. No, this can totally be fixed. Okay, just like we can lay down new skin and, heal a wound, we can heal internal wounds, per se. So this is really, again, this is a healthy mucosa, if you can read. And I know it's really tiny on what I printed, but acute inflammation, gram-negative proliferation, and then we have full invasion. There's nothing there protecting us. We don't have any more flora helping. Our gap junctions or our cells and epithelium are all broken down. And this is what is known as leaky gut. Our gut is physically leaking or leaching negative things into our bloodstream. And again, bloodstream and vasculature is the highway to every other organ in our body. So if it's happening here, it's happening everywhere. But I have headaches. What does that have to do with my stomach? But my left knee hurts. What does that have to do? It all is interconnected. We're not just individual parts. We're a whole being. And we have to take all of those things into account when we look at our health. Starting at that level. Number one place I like to start. So other functions of the immune system. Prevents pathogen invasion, which we know, right? So here's the eye, nose, throat. That's that IgA. Okay, when we produce mucus or we produce our eyes tear, that's our body saying, push out, get rid of you. Mucus encapsulates bacterium, viral cells and things, hoping that it pushes it out so we get runny nose, we get phlegm, we cough things up. That's all our body's defense mechanism. So it's another form of our immune system turning on. the body, looking for mutated or cancerous cells. We constantly have these security guards, if you will, going through the system. Like, are you good? Okay, you're good. Or like, are you bad? Everybody, this is a bad cell. Let's work on it. Okay? Cleaning out old and dead cells as well as debris. Damage. Dead cells like macrophages are these great cells that just kind of float around. And when they see, oh, this is bad, they encapsulate it and essentially swallow it and break it down. And then that leaves the space that's no longer there, so now I can put good, healthy cells down. But if this is still there, because my immune system isn't working well because I'm too inflamed, and everything's focused over here, meanwhile all this is going on, your body can only do so many things at once, just like we can only do so many things at once, right? There's a certain extent where our multitasking starts to fail and our quality of work goes down. Same thing happens in our body. So if your immune system is working hard in your gut, what other functions is it not performing?
So what's the other area other than gut? Do you find like gingivitis being another area that causes a lot of problems?
Gingivitis, the inflammation of gums, can be caused by a lot of different things. It is the first step in digestion, so if you have a hard time with your gum health and your teeth health and you're not breaking down your food, it's inevitably going to affect every other step of digestion thereafter. But gingivitis could be poor oral health, right? But it can also be, it's a sign of anything with itis means inflammation. So if you're having that, there's probably other inflammation happening in the body that you might not be completely consciously aware of, but guaranteed, you clean up the gut and you'll notice that improve.
Because I always hear like people in my family when they have to get surgery, they're sent to the dentist first to make sure they don't have gingivitis like when they're going to have a planned, double bypass or something. They're
Right.
sent to get their teeth. Like my cousin's waiting for a lung transplant, so she had to go through.
And that makes sense.
So is that just in the gut?
It's basically, if it's in the mouth, it's going to get in the gut.
Okay.
If it gets in the gut, it's going to get in the bloodstream. If it gets in the bloodstream, it's going to go wherever that surgery was just performed and potentially cause an infection or rejection.
And so they're trying to get rid of this inflammation so that it can concentrate on what they just.
Exactly.
Okay.
And to avoid causing even more inflammation with the procedure or implantation or whatever's occurring. That's a good question. So how do we reduce it? So we know the problem now. We know what it's causing, right? We know the issues it could be leading to, but what do we do? So if it's local, aka this joint hurts. Systemic means it's in the GI and it's causing a plethora of issues. But local, because of an injury or a trauma, you want to reduce that local inflammation. So how do you do that? Movement. Think of like static water. Gross things grow in static water, right? So moving water. When things move, it feels better. You want to avoid stagnation at all costs because it causes stasis or sitting water, for lack of a better analogy. So even gentle movement. Yeah, my joints hurt really bad. Totally understand. Do not exacerbate. Do not injure yourself more. But it's the difference between jogging a mile or just doing small leg lifts at your desk. That's still movement. That's still something. Even if your range of motion is 1 degree. It's better than just sitting there doing nothing. Alternating hot and cold. So we talked a little bit before, why does it get hot in the area? It's because it dilates your vessels, making a 2-lane highway an 8-lane highway, right? So more nutrients can get to the area. And then we put a cold flash on it to constrict it and cause it to pump it back up to the heart and lungs to get re-oxygenated, re-nutrified. And then we do hot again to dilate and take all that clean blood that we just cold flushed back up, back down to the area. So we do hot and cold alternating to create that kind of pumping motion to clean up the debris in that area. Ice alone, it can actually cause, like this says, rebound, increasing swelling and increasing inflammation, which is not a great thing. So that's why we constantly need to do the alternating. So herbal and enzymatic anti-inflammatory supplements are great. Bromelain, which is the active enzyme in pineapple, eating pineapple or taking enzymes like that. Papain is in papaya. It's a great active for digestion, for joint pain. Capsaicin or capsicum, which is the active ingredient in hot peppers. It's in icy hot and things like that. If you put it locally, it can create that pumping or that warming, right? So things like that can also be used both topically and ingested, like we just talked about. Systemic inflammation. We need to remove the cause. Again, not to be a broken record, but it hurts when I do this. Okay, I'll stop doing that, right? It hurts when I eat this. Then don't eat that. That's probably not great for you. The good news is like when we saw in the epithelium picture, we can move backwards in health and get to that healthy epithelium, and then you can probably eat that food that when you're in that later stage of degradation caused problems, bloating, pain, headaches, food hangovers, as I've come to know them. So when you heal it back, then you can reintroduce and probably not have an issue. But how long does that take? Well, how long have you had your symptoms? If it took you 10 years to get to the place where that's when you're actually doing something and testing, it's probably going to take a few years to rebuild that epithelium. If you've noticed a problem for the last year or two, it could just take a few months. And again, every person is different. Some people bounce back quicker than others. You know, it takes 4 to 6 weeks to heal. Some people are healed in 3, some people take 10, you know? So being patient with yourself is really important. Anti-inflammatory foods, herbs, supplements, things that we know from research, when ingested or applied, boost that body's ability to clear out debris and lay down new cells. That's what we're talking about with the anti-inflammatory, natural anti-inflammatories, because we're not shutting down the response completely. If anything, we're supporting the response in order to make its life shorter. Does that make sense? It's an interesting concept. Decreasing exposure to your toxins and pesticides, like I said, ever since I moved here, XYZ, well, let's decrease our exposure to those things, right? Ever since I got my cat, or ever since I started using this toothpaste. Those are things we should probably, remove from our lifestyle, if possible. Promote a healthy GI tract. Probiotics is the #1 way to do that, as well as removing potentially inflammatory foods. Probiotics are kind of our bouncers, if you will, at that gut level. They kind of stand there and, let me see your ID. Are you a good guy or a bad guy? So they help regulate what comes in and what stays out. Regular exercise, again, no stagnant water. We need to move, even gentle movement. Pools, stairs, walking, slow walking even, is better than nothing at all. And stress reduction. If we're doing all of these things above stress reduction and we're not noticing an improvement, stress is the core of the onion. That's the thing that's leading to all of these other systems breaking down and adding to your inflammatory response. So we all can't be Zen monks, I get that. But if you take those 10 to 30 minutes a day to get in parasympathetic, ideally before sleeping or halfway through your day in a stressful scenario or situation, that's really the place where our body can start acknowledging where the issues are and where it needs to heal. Otherwise, it's just trying to keep up with you and your stress and solving problems and to-do lists. So by the end of the day, it's too exhausted and too degraded to work on those issues that have, added to the inflammatory response and built up over time. So, okay. Weekly exercise. Everybody get your hand out. We're going to do an inventory. It's the one with the little checklist and all the lists. Make sure does everybody have one?
You don't have one.
Do we have any more?
Yeah.
Oh, is this it? Yeah, maybe you do that.
Oh, yeah, you do.
Does everybody have it?
Yeah, right there.
Need a pen? Okay. So I know this is a food allergy, so that top list, please, or the top statement, please ignore it. Cross out 1 and put 15 to 20.
Okay, I was like, wow.
Cross out 1 and put 15 to 20.
Where's the one?
Right up top where it says, if you have 1 or more.
Oh, okay.
I don't know about that's the lab trying to say, hey, test everybody, which could be a good thing, but clinically it's not really indicated unless you have 15 or more. So go through and check every box that applies to you. If you currently experience it, or have you recently in the last 30 to 60 days experienced it?
It's really exciting for me.
Aw. Oh, we're working on it.
Yes. Good thing we gave the timeline because I don't have a lot of these anymore.
And those listening at home or on YouTube, feel free to take a moment to do the checklist as well. And then when you're done adding up your check marks, and when you're ready, no rush, flip it over and answer those questions as well. So if you've completed both sides, and take your time if you haven't, for every checkbox on the front, I want you to account for 1 point. And then on the back, for those top 4 questions, anytime you clicked yes, that's another point. That first, do you or anyone in your family have a history of allergies? If it's yes, that's a point. Omit the next one. If you've ever been tested, that's not indicated. Add a point for any of the boxes underneath. Do you have allergic reactions within 15 minutes of any of the following? And that will give you your total. So I want everyone to write their total down somewhere on this page, maybe at the top. Again, there's no rush, so if you need a couple more minutes, it's fine. Is anybody not done? Okay. So, who got less than 10? Great. What was your number? Great. So she assuming, you know, not knowing a lot of other factors, we can probably safely assume doesn't have systemic inflammation. That's a great thing.
Yeah.
How many of you got 10 to 20? Okay. How many more than 20? Okay. So in the 10 to 20, I want you to seriously consider testing if that's something that makes sense to you, because that's definitely treatable. 20 or more, it's very indicated for you, okay? Because that means that you do have systemic inflammation. And there are things going on that, try as you might, are unfortunately negatively affecting your health and could be potentially turning on or regulating genes for disease factors that could lead to things like autoimmune, cancer, Alzheimer's, all of those things we saw on the checklist up here. And, you know, could be 5 years, could be 30 years. But the important part is to kind of nip it in the bud if you can at this point, right? As much as possible. Did anybody have any questions or kind of, were you surprised with your number? Anyone? She's like, Anybody else surprised?
I was surprised that most of mine were on the back side. I thought I had more on this side.
So you have more of the anaphylactic type.
Yeah.
Okay. So those are more environmental and the way your body's processing things. Okay. Versus symptoms related to food, maybe. Anybody else surprised or have questions about their results? Makes sense for the most part. I was 6. 2 years ago, I was 22. So it's possible. That's the good news.
I'm in the 40s, like.
And I'm assuming before you started seeing
Yeah.
me, they were even higher.
Yeah, well, and this is based on 3 months. I don't have all of these things anymore.
Okay. So if you had to go
So-
through what you had now, today, this week,
I
this
would-
month,
I would imagine that this would, I don't know, I should probably do that.
I would love for you to do that so they can kind of see what you've had
Yeah.
experienced versus what you currently are.
Yeah.
Because you're a prime example of when we did test for food allergies, when we do take more probiotics, when we do increase supplements that clear inflammation and balance things out. So it could be good feedback for them. Okay, so that's a great way just for you to have some self-awareness for yourself at where you're at, and keeping those checklists, or emailing me if you want another checklist, maybe doing an elimination diet, maybe removing foods you know for a fact already. You don't need a food test to tell you, I eat this and I feel this. Maybe removing those for a couple weeks and redoing the checklist and seeing. For environmental, getting air purifiers, right? You know, skin disorders are usually, or reactions, are usually a direct result of gut. So adding a probiotic, drinking more water.
That's what I've been focusing on, is drinking more water. And since she puts the nice
Uh-huh.
water out, it makes a huge difference in me to be able to drink more water.
Yeah.
So that's, water is again how we clear things out. So it's kind of like if we don't drink enough water, people are like, oh, it's so hard, or it doesn't taste good, or whatever the reason is. It's kind of like us starting to take a shower every day and the water shutting off halfway through. We're kind of soapy and clean, but we're kind of dirty and gross. And you just go throughout the day like that. So imagine doing that for a week or 2 in a row. You're not going to be very fun to hang around, right? Or functioning at your best. It's the same with internal water, okay? We need to have that internal daily shower with water. So a good rule of thumb is half your body weight in ounces. And in the summer, you want to add 20 ounces because of the heat here. It's just drying out. So, like, I weigh 150 pounds. So 75 ounces plus 20 is about 95, and I shoot for 100. This is 27 ounces, so I do 4 of these a day. And that's kind of how I monitor. Otherwise, I can't keep track of glasses or plastic bottles. They're just, it adds up too quickly. So that's why I use reusable. It's just easier to track. So how many of you kept your date? Oh,
I got 10.
did you hear that?
You went from the
Nice.
lowest
Did everybody hear her?
Yeah.
So she was 40 in the last 90 days, and this week alone, 10?
To about 10, yeah. And some
So-
of those 10s are caused because I have issues with medicine, like supplements and stuff, and trying to
We're trying to figure out
why.
what her body can assimilate. She's very sensitive, slow and steady. Some people want all 5 things that are going to help them. For her, it's building. We need to do 1 at a time and kind of build from there. Let her body get used to it and then move forward. That number is going to be a lot lower, hopefully 0.
Yes.
So you can see after the allergy testing and, you know, applying these different basic rules, water, working out, moving your body anyway, as much as you can, I know.
And that's still an issue.
Yeah.
For me, so that
So-
will even change these numbers from the ones
I think for you the big thing was probiotics and water.
Right.
And then obviously removing that daily banana.
Yeah, right.
So when you say probiotics, is that the thing that's linked to that, where people can't eat a lot of foods because they get the,
That's acid reflux.
not acid, but I forget the name of the bacteria that forms in the lungs and gets built up when they, is that what you eat the probiotics for?
Probiotics is the gut.
Candida.
Candida.
Sorry.
Yeah, no,
There you go.
candida is, we all have a little bit of candida, but candida is one of those things that feed on sugar. So if you're addicted to sugar, you're probably having an overgrowth of candida, which is important in this amount, but most people, especially women, have this amount. So yeast infections, rashes under, between breasts, armpits, knees. You eat a lot of sugar. Like for me, if I eat a lot of sugar, the back of my knees itch. That's a trigger of candida, things like that. And candida is one of those things that inhibits us from having yeast like baker's yeast and brewer's yeast and things like that. So that's an overgrowth.
Or
So
like
what?
mushrooms or something, is that true?
That's a fungus.
Okay.
So they're kind of all cousins, but they're not exactly the same. So probiotics actually make the good guys more populated than the candida. So if you're not taking a probiotic but you have some of those symptoms or recurring that I talked about that could be candida, it's probably candida versus good guys. And so by taking an oral probiotic over time, usually 3 months is how it takes to shift microbiome at that level, then we have more good guys than candida. And then our balance is there and our symptoms resolve. Clarity of mind, mood stabilization, even all that stuff. Because again, this serotonin and stuff like that is released at the gut level. So the good rule of thumb for probiotics without having you as patients. So this is, I have to preface, no way actual clinical treatment. But if you're just asking me on the street as a person, has to be refrigerated because it's an alive organism. And it has to have 15 billion with a B cultures or more.
And what's the?
And you just take 1 cap a
probiotic?
day.
Is it like a yogurt?
Yogurt has this much probiotic compared to a pill.
Okay.
So, and then you have the negative inflammatory effects of the dairy and the sugar in yogurt. So everyone's like, well, I eat yogurt every day. Well, are you still overweight and not feeling good? It's probably not treating the problem. You need a clinical level, right? So we have what are called therapeutic doses and maintenance doses. When you come into my office and you have all these problems, I'm going to give you the therapeutic dose. Once we give you the therapeutic dose and get you normalized or where you need to be out of the danger zone, then we can wean a little bit and put you in maintenance doses, which are a lot less than therapeutic doses, but they're enough to give the body what it needs to empty out that cup every day. So a probiotic, however, in most cases is kind of a one-size-fits-all. 15 billion cultures a day across the board, therapeutic or otherwise, unless it's clinically indicated, right? Or unless you have a contraindication. What if you have too much gut flora causing indigestion and you have signs of SIBO? Small intestinal bacterial overgrowth. I need to know about that. I'm not giving you probiotics. It will make things worse. But that's maybe 1 in every 30 patients I see might have signs of SIBO. It's very rare compared to, it's more common to see lack of probiotics than too much overgrowth, if that makes sense. In some cases, if a woman has constant, she's had a yeast infection for 2 months straight, the poor thing, and she is miserable, she's got rashes everywhere, yeah, I'm going to have her double up on probiotics for the first 30 to 60 days and then drop her down to 1 a day thereafter. So that's the therapeutic versus maintenance. But if you're not that far gone or that severe, just 1 a day is fine.
And do you include all 3 of the, I was told there were 3 different types of amylase, lipase, and
Those are enzymes.
okay, so do
Lactobacillus, bifido. Those are like the ilices,
okay,
asperillus. Like those are those are probiotics.
okay.
Amylase, protease, all of those are enzymes for digestion. That helps just break it down at the stomach level. So if you get acid reflux, if you get nausea right after eating, you're probably what's called hypochloric or not enough digestive enzymes. So taking those to help at that level. And then step 3, because 2 is small intestines, right? So next is at the colon level, and even some of the small intestines, that's where the probiotics really do their work. So they're at different levels of digestion. We want to make sure each and every step is clean and doing its job.
So So is there one specific one that is the best, or is it each one for each job, or how does that work with
I personally, for probiotics, I love Claire Complete. Klaire is the brand that I personally choose. You can't get it over the counter because it's physician strength. But that doesn't mean that there aren't great probiotics that you can get at Whole Foods or Trader Joe's or something, right?
I
As
got
long-
it at Amazon.
Yeah. Which saves a lot of money compared to if I ordered it from Natural Partners. It's probably like $10, $12 savings or something like that.
But would it, now would that have lactobacillus in it, or what?
Oh, yeah.
Okay, would it have the others as well? or
Oh,
just-
yeah.
Okay, so it's a combination of,
Mhm.
and, okay.
It's multiple strains. So refrigerated 15 billion in at least 10 strains. Great question.
Oh,
At least 10
okay.
strains. Because the more diverse our population, our flora population is, then the more versatile it can be. Right? If we took one type of probiotic, but we need 10 more, that's great for digestion, but what supports immune system? What supports, epithelial growth? All these other probiotics do other jobs. So they have to kind of work in tandem for the best result. So that was a great question. Thank you for bringing that up.
And another question.
No, it's
sorry,
okay.
I have so many. The big fad now is the quinoa, or however you say it. Does that have negative side effects then? Is it not something you recommend in a daily diet?
Oh, I love quinoa. The thing is there's such thing as too much of a good thing.
Yeah.
So you never want your body, you want to keep your body guessing. Just like when you work out, if you do the same workout, you plateau and then nothing works and then, it's not effective. Same with food. If you eat the same thing every day, it's like you're going to cause more degradation. Bananas are inherently good. She ate one every day for so long that her body started having a reaction to it. So quinoa, to me, I probably eat it 2 to 4 times a week.
Okay, so go there to sell it and maybe whether it can't be that great because I like it too much.
No, quinoa is great. It's a complete protein. Okay, it's an ancient grain, so it's gluten free. So it's not pro-inflammatory in that sense. And by complete protein, it means that it has all of the amino acids. Amino acids are found more times in nuts and proteins and meats and eggs and things like that. So to have, all your amino acids, which are your basic building blocks for proteins, in a grain is very rare, which is why quinoa was the big fad. I think it's an inherently great thing to eat, but again, there is such thing as too much of a good thing.
So then I have one other weird question. Corn, which I know, right, the bad things about corn, the way we harvest it here. If people are growing their own corn, is that seed that they're getting still the same kind of?
Unfortunately, it is in most
So,
cases.
my mother-in-law was asking if she grows her own, and I was like, telling her about.
Well, where'd you get the seed?
Pesticide. I go,
Right.
I got the seed. She goes, yeah, but we get worms in our corn, so that must mean it's not in there. I'm like, well, now I'm not eating her corn. But, but I thought, well, maybe it's because they probably put pesticides on top of the growth of the seed pesticides on the big farms and sell it. So that's probably I don't have corn.
So, there's a couple schools of thought here. So, if you have a GMO corn, genetically modified corn, that's inevitably going to affect its growth pattern, right? And its process, its nutrient uptake from the soil and things like that. So, if you have a corn plant that's a GMO, herbicide, pesticide, all that stuff, and you take the seed and then you plant, but I use all organic everything and I don't spray anything on it, but it came from that toxic plant. At some level, yeah, it's not going to be as bad as this one because it's in an organic environment, but it's still inherently GMO and was raised in a way that's not going to have the same effect in our digestive tract as like a wild maize or something like that. So unless you know for a fact you can get it from like a local organic farmer that's non-GMO, that is, wild versions or strains, the more colorful the corn, the better. Too, because they're less likely to be GMO because most people don't eat purple and red corn. They want the white or the yellow. So that's usually what's most tainted. So things like that to consider, which is so funny because I have farmer friends who they hoard it like gold. Like, you can't have my corn seeds. Because it's really that uncommon. Just like with soy, just like with wheat, the GMO factor, the toxic factor, it's really, really challenging unless it's, shipped internationally to get really high quality, clean seeds for those certain crops.
And as far as you know, the quinoa isn't like genetically.
Not yet.
modified?
Not yet. And I say not yet because unfortunately, the FDA and things like that, and Monsanto tend to take great things and figure out a way to manipulate it so that it can eventually cause problems. But yeah, right now quinoa is great. Amaranth is a good one.
What was it,
Amaranth.
What is that?
It's another grain that's gluten free. That's a good, fighting inflammation.
How about wheat berry?
Wheat berry's wheat.
It is.
Mm-hmm.
So
It
it's
tastes
not so
good.
great.
It's kind of
Yeah.
more chewy and delicious if you've ever had it,
Yeah.
but it's still, byproduct of wheat. So unfortunately, what's the new one I was just reading on the flight home from Florida? Actually, sorghum. Sorghum. That's kind of like the new gluten-free grain that's coming out. It's kind of chewy. It's a little bit bigger than rice and quinoa. Quinoa's fluffier, but that chewy quality that some rice can have. It's a little bit more like that, so it's close to a wheat berry, but it's gluten-free, and a lot of people are using it now in cooking, and it's going to be like the next quinoa. So that's something you can, purchase and use too.
What was the name of that?
Sorghum.
SORGUM. They use it actually a flour also.
When
Mhm.
it says gum, it doesn't have the gum properties, does it?
It's a
Like
flour
tree
gum.
gum or anything?
It's just a grain, and so it's just kind of,
This gets scared me.
yeah.
Okay.
And that's when eating it, if you ever want to introduce something new to your diet, eat it every single day for 3 days at multiple meals if possible. So have it the flour in a bread, and then the grain in a dinner, and then a toast in the morning. And the more you eat it in that 3 days, the more saturated your body becomes exposed, and the more likely you are to exhibit a symptom. Versus I kind of pebbled it in here and there, and at the end of the week I had constipation or diarrhea, but who done it? What variable caused that, right? Where when we're saturating the system for those 3 days as much as possible, we know that's really the only thing that's changed outside of my normal diet, so that has to be the culprit, more or less. And then I guarantee if we ran a food allergy panel, 95% it would show up if you had a reaction. So, and some get under the radar where you don't, again, the banana, she didn't have an overt reaction, but she was having so many symptoms. What if she was having banana reactions and didn't know it, right?
Yeah.
The sluggishness, the brain fog, the GI issues, any and all of those things could have been caused by the banana.
And pineapple.
That's
Hold on, here's that, that's just not awesome.
Oh, yeah,
Yeah, those are
Telling you.
just symptoms of menopause.
yeah, and you just have to live with it. Well, I'm
Yeah,
not living
But
with
at
it
least it's
anymore.
one point two of the
I'm
internal
not living with
medicine
it.
doctors, they told my husband, she said, oh, you have high cholesterol, you just have to keep ricin, change your diet will do nothing. And him and I are like, no, we're gonna try it first. And so my girlfriend gave us a heart healthy, we followed it, and within 6 months he was from high to perfect normal
Yep.
cholesterol. And we just stick with that diet for the last 6 years.
Oh yeah, I get it all the time. I mean, a lot of MDs unfortunately try to bully patients. I've lost patients because they believe their MD they've been seeing for 10 years versus like this new age ND doctor who's young and may not know what's going on. So, and we get questioned a lot about it and sometimes even bullied, about what we do because how can that really have an effect? But in my school of thought, it's how can our biochemistry and the nutrients in our food and the way it feeds pathways, to me, that seems the obvious route, right?
Well, that we ingest food every day, so that's one of the biggest players. But I didn't know if it was going to work for food either, but just one of those try things.
And I'm
And then
so
I was
glad
like,
you
wait a
did.
minute, she was going to push us on this drug, and we
We
would
had the
have never
same thing.
tried it. And so I'm glad we tried it. But so now that makes me, wonder what else could I?
What other
do
issues,
medicine-wise?
yeah.
Exactly.
I mean, the average person over 65 is on 8 to 11 medications, and 90% of them are managing symptoms from the original medication. So-
There's so many symptoms on those drugs.
So with stats like that, to me, that's really not living a healthy lifestyle. That's managing symptoms. And again, it's like I've used this before. If the sink is clogged and the faucet's on, am I going to mop up the water that's leaking on the ground and try and play catch up, or am I just going to walk over, turn off the faucet, and unclog the sink? That is that type of medicine is you're working at the root cause. You're treating your diet and what you're exposed to on a regular basis versus taking the drug, which is just mopping up the groundwater.
I mean, I believe there's some cases where, yeah, you have to take the medicine.
Like with thyroid, and there are a few things where your body physically doesn't make it, or like diabetes type 1. Where your body just stops making insulin altogether. If you're not making insulin, you cannot regulate blood sugar. You will have to amputate limbs and have neurological issues. You have to take insulin. You have to take exogenous, meaning outside of you, because you're not making endogenous, which means inside of you, right? But diabetes type 2 just means your body is no longer sensitized to your own insulin because you've eaten so much sugar and have been so stagnant in most cases. So that's highly linked to obesity, or the inverse is wasting syndrome. You know what I mean? So the body can't regulate sugar. It doesn't know what to do with it. But if we change lifestyle, a lot of times, type 2 diabetes,
What my husband's going through.
yeah, I would love for you to speak to that if you don't mind.
I don't mind, yeah, because my husband ended up in the hospital. We had no idea that he had diabetes at all. I almost lost him. It was a horrendous deal. But I have to say, he's been going to Dr. Kelly, the other gentleman. You guys have met that doctor before. So he's been going, he co-sees both of you.
But mainly Dr. Kelly.
Mainly Dr. Kelly. And a regular doctor. And my husband wasn't into what I was doing. I've been doing this for about a month before this happened to him with Dr. Jackie. So he wasn't tuned into it. He didn't whatever. He didn't believe it. That this could even help me. But it did, instantly, actually. I felt the symptoms start to alleviate, all those things they told us about menopause and you're going to live with it. Well, it started going away. But anyways, going back to my husband, so we went into the hospital, and I said, okay, they saved his life. He was in ICU for 2 nights, and then into the regular room the next day. And going home with 4 injections of insulin a day. That's huge. Most people go home with pills, but his insulin, his blood glucose was 800 when we were in the hospital. And normal people, like most of us, are around 100. So he was, he was really close to dying. I had even texted her the day before, and I said, hey, this is what he's doing. She goes, you need to get him to the emergency room. And I'm hysterical. He wouldn't go. That morning, he said, yeah, you need to call the ambulance because now I can't walk. And it was that drastic. So that's what can happen when you don't listen to what your body's telling you. He had lost so much weight. He was the opposite. He was, like you said, he was the wasting. He had lost weight, and he thought it was because he was getting older. He got to this age, this big number, and he said, yeah, it's because of this. That's why I'm so tired. I'm working. I'm stressed. All those excuses we made with the body told him what was going on. Well, I don't want to take up all the time here. But so he's been going to Dr. Kelly for about 2 months now, and he hasn't taken an insulin shot in 3 weeks.
Wow. Nice.
Holy cow, from 800 to
3
nothing.
weeks. His doctor told him, and I said, okay, go to Dr. Kelly and go to Dr. Lee. Go to the 2 of them and see what happens. See what they tell you. Go on the same day. Just listen to me for once. You didn't listen to me and you ended up in the hospital. Just listen once. So he goes to both of them, and he says, yeah, you're going to be on this for the rest of your life. And, these are your symptoms. Your father had it. You can't beat this. You're lucky to be alive. He goes to Dr. Kelly and says, you're lucky to be alive, but let's get this. He says, I don't want you to be on this the rest of your life. I want you to be off of this in 10 months. Well, it didn't take 10 months for my husband. He was really good. He did it. He does his diet. He writes in his diary. He does all of that. And he stopped smoking. He was a smoker too. So, he's proof of, I wish I could get him to come.
That would be
for one of
great,
these times.
especially for he's probably at work, but next week when we talk about sugar at the Lunch and Learn.
Yeah, and what it did. He was craving sugar, and he was not a person that would crave sugar.
Wow.
I had my chocolate every day. He didn't, but then about 2 months before, he was having a bag of chocolate, of the M&Ms. He would have them on his nightstand, and he was eating those, and it was like, I don't know, I just like these now, or a bowl of ice cream. And all of a sudden, we didn't know what that was, but it was those cravings, and his blood sugar, or his sugar levels were so high that they said his blood was like maple syrup. You could pour it in and you could see it when they drew blood. You could see it so slow coming out. So
Viscous, yeah.
it
And
was really
he's
scary.
craving sugar because what insulin does, which he was no longer reacting to, insulin allows sugar to go from the blood, or what we're eating, into the cell to create energy. So when no insulin is being, responded to, no sugar is getting into the cell, so the cell's telling the body, hey, I need sugar, eat more sugar. But it's just recirculating in the blood, it's not getting into the cell. And so he was craving sugar because the cells were desperate to get it, but it wasn't making that transition because his insulin wasn't being sensitized enough. So he had to inject insulin to the point until he corrected it enough to open up that gate of communication. Now the insulin is being picked up and the sugar is going from the blood into the cell and the cell's functioning normally again. So it's things like this, and it's miraculous to me, but it's like, it's basic science to me. It's not magic, right? It's not,
It's just the knowledge that we don't have.
Exactly. So that's why we do things like this, so that we can spread awareness.
So
Because
would that make you high risk of stroke then with diabetes, because it's making your blood saturate?
so viscous. Oh, of course, clotting, things like that. If he had signs of atherosclerosis or hardening, and his vessels weren't like flexible enough to
like
deal with or
breaking.
compensate with that, he probably would have had an effect. Like they said, he was hours away from a stroke and myocardial infarction, heart attack.
AA, all that.
Yep.
Yeah, everything.
It's funny, you can't convince certain people that they look at, oh, I'm diabetic now, I have type 2 diabetes, it's just like type 1, and it's not at all.
At all. It's a
It's not
completely
at
different
all.
mechanism, and they don't educate themselves enough because it's like, okay, well, you know better than I know myself. It's giving their power away, right, to the powers that be. And it's
It's crazy.
like, I'm a team member for your health. I am not a dictator. Again, I'm just the translator. You do what you will, and he took it and ran with it.
But in 2 months, he's just
Yeah,
so much
and
better.
even, and then that, he could be like, maybe not everybody could do that, cause he's really, he's adamant
Being
about
very
what he's
strict.
doing. He's strict about doing it. So he's, but his doctor the last time when he went, he told him, yeah, well, you might be able to get down on pills pretty soon, cause he saw his average, he's really good, he writes down his blood glucose numbers every time, 4 times a day he's testing it. And he's like, yeah, that's really great, and keep doing it. You might be able to go on pills eventually, but 10 years from now, you're going to go back on insulin because that's what bodies do.
So
That's
his
not what Dr.
Wow.
Jackie and Dr. Kelly said. So
Yeah, so that makes you feel defeated.
Of course. And then you have
Right.
no motivation, and you've been poked and prodded and told all these things, and that's what you're convinced of because you don't really know anything better. So
yeah,
But you're right about the whole how they like to bully how you guys go about stuff. Because my husband's specialist, we were trying red wine because it's supposed to lower platelets, and it was working. She didn't want to hear it and said no. We were trying garlic too, and it was
You-
helping. And
you
she
know
was
your
saying
body's
no.
better than the doctors do. Please have faith in yourself. Listen to your signs and symptoms because
But they do. They're like, oh, all that stuff is just. I'm like, well,
right? They
why
think
is
I'm
it
like waving a
working
magic
though?
wand or something, or like sitting there banging a drum and chanting. They have no idea that it's actual science being, implemented with people, and it really is.
Maybe
That's.
it scares them or something. They don't even
I-
realize.
I think as a whole, and I don't want to make any umbrella statements because I really do value their type of medicine, and I think integrative medicine is the future. But I think that the way that they're taught is that's the only way. There's no other way.
So they just see that
And
as-
exactly, and there's a pill for everything, and that's how they're taught. This is the problem. What pharmaceutical matches it, versus what are the other actual biochemical things happening, and how do we, approach that? And a lot of times, unfortunately, and I hate to get into conspiracy theory, but pharmaceutical companies and insurance companies pay them. So we have two things happening.
They make money of it.
So we have two things here. If you're pushing the drug as a physician, that's why I make probably a third compared to an actual like MD, because I don't push pharmaceuticals. So that's like a level of income I'm not bringing in. But in addition to that, insurance companies pay on volume. And so if you see 6 patients in an hour at 10-minute intervals, you're getting paid more than if you saw one person that hour and really did a thorough job of really, exposing what the problem is and addressing it. And so they're getting kind of, bullied themselves.
Yeah,
So when
keep
I
that
walk,
way.
yeah, so when I walk in and I say I have no third party like loyalty in terms of being like nutraceutical, pharmaceutical, I'm not getting paid by anybody, and I'm cash pay, I don't take insurance. I think they see competition. I think they get nervous. I think they start to doubt themselves, and so instead of being open to a new school of thought, that's invalid. That's
That
not
makes more sense though, because she's always worried that we're
Yeah.
gonna get a second opinion or whatever.
exactly. Where it's like, I want you to get a second opinion.
Right.
You want a second opinion? Here's 10 referrals. Please go do it. If I don't take your insurance, go to somebody who does, who's a naturopath, or somebody who's a DO, or at least open to integrative, right? Because at the end of the day, it doesn't matter what's in my pocket. It matters how you're living your life and how well you are and how you feel, because that to me is the most important thing. And it's, and then you have research. Well, research doesn't support it. Well, who are these research companies funded by? Pharmaceutical and insurance companies. So, it's kind of a catch-22, and it's like this self-fulfilling, terrible prophecy, And then you have the people who are supporting herbicides and pesticides on plants, like with Monsanto, and they're on the board of the FDA, and they're in each
They're
other's
pumping
pockets.
corn in every kid.
So I think that they, somewhere along the way, really lost faith in you guys, in us as a whole, as people. They'll listen to anything we say. Everybody's sheeple. They're not individuals who can critically think, right? And for a small time, when penicillin came out and all these miracle drugs came out and lives were being saved, and we learned that washing our hands in between, opening up a cadaver to learn their body parts and then going down the hall to deliver a baby, and the baby and the mother die, and we're like, wow, we should wash our hands in between. That's a miracle. Those, right? So it's things like that they were like, doctors, MDs used to be thought of the way NDs are. Those are quacks, And then because of penicillin and other drugs, it was like, you're saving lives. And then unfortunately, again, too much of a good thing, it kind of just, got corrupt in a sense. And so now we're looking at the state of things as they are, and that's why the power needs to be given back to the people, and you need to make your decisions for yourself. And if it is a pharmaceutical and that's working, do it. But if you are sick of that, or you're convinced that there are other ways, then please explore them. Please educate yourself. Ask critical questions. And everyone's like, sorry, just one more question. No, like more. Like, that's what I do. Come on, ask away, because that's how you're going to be empowered. And that's the whole women's empowerment. I'm educating you to empower you to affect the choices you make, so you can apply all of this stuff in your daily lives and get those numbers down to 5 or less. That's really the goal.
And that's why Border States does this for us, everybody, because they know the power of wellness instead of what we can do with the insurance companies, even though they don't cover it. That's what this is about. So that's why, they said yes.
I feel so lucky that I ran into her at a NAVO meeting. She's like, we should do this.
Business cards or?
Hmm?
Do you have business cards?
Oh, yeah, definitely.
I have them downstairs on my.
I know it's getting, if not over, okay, it's 15 minutes over, and I know we started 15 minutes late, but last thing, assignments. Keep your daily log, start noticing trends, email me, bring it up in our next meeting if you have any questions about trends that you're noticing. Inflammatory foods, so you have your inflammatory fighting diet handout, right? So it kind of, the last part of that handout, if you flip it over, those are detailed lists on the front. On the back, it'll give you a table that is kind of a quick key. Things that are known to cause inflammation versus things that fight inflammation. Okay, so I want your assignment to be to remove as many of those pro-inflammatory foods as you can and introduce as many of the anti-inflammatory foods as you can. Okay? So that little table, exactly. In week 3. I think you're still in week 1.
Here you go. We're in week 3. So right here. So it's in week 3, the very end. Less than there.
I had nothing else.
Okay.
I don't have nothing else. I don't just have any memory. Was I supposed to? I know something
Well, I don't know if I added mine.
We added ours.
Wait. Got it? Did you miss your suckers? Not all, I got.
Oh, that is it. Oh, they were just stuck together.
Okay, so
gonna say.
again,
I'm like, ready to
I'm like,
The day's about over.
focus on removing pro-inflammatory, focus on introducing anti-inflammatory foods, and then there are certain exercises that have been known to clear inflammation. Again, we don't want to be stagnant sitting water, right? So play around if you can, if you have the mobility, and without hurting yourselves, try to see if you can incorporate one of those exercises. Even just one day, 1 week, the whole 4 weeks. Just try something, because as you clean up the diet, the exercising is going to help move things up and out. And then water, please water. So, go ahead.
I've taken myself off all the medication, the pharmaceutical pills, but I can't seem to break the leave 2 in the morning, 2 before I go to bed. It's almost like I go to sleep if I don't take it, and I know that can't be good for me.
No.
Because then I'll go in and have blood work, and they're like, oh, your liver enzymes are really high. It's got to be the NSAIDs. I'm sure
It's definitely the NSAIDs.
Yeah.
So you're degrading, you're causing liver inflammation, right? So your liver can't conjugate or basically filter anything that you're taking in, whether it's a drug, a food, pollutant, a hormone, right? So when you take more NSAIDs, you tend to have more hormonal issues because it's clouding the liver's ability to break down and or build healthy hormone levels. So if NSAIDs, if the reason you're taking them is because of pain,
Yeah, I broke my tailbone twice, and it's never healed back, and I sit all day.
so I definitely suggest seeing somebody laser therapy to help heal and clear it, right? Injection therapies like Prolo or PRP to help lay down new cells in the area to, heal that, create more cushion in the area. We don't want encapsulation or anything like that. We just want everything to heal well again. Or you might have to set a timer every 30 minutes to get up and move. You know?
Sometimes you guys can see me, sometimes I get up to go move, and I'm like stumbling. I can barely make my hips.
Move. Do you see a chiropractor or a soft tissue therapist or see you?
No, I've done away with doctors' services.
I would love for you to come see my office. I work with a massage therapist who does deep tissue and injury specific yeah. So and that's going to help, right? It's going to loosen the tissue.
I have Amy coming this month too. So
Yeah.
you could talk to her
Massage
about
therapist,
it,
she's
too.
great.
It's like
We have
right there.
We have a chiropractor with laser therapy. We do acupuncture. We can do physical manipulation, soft tissue, osseous or bone manipulation. There's so many things that we can do to help your body catch up to itself so that you don't have to take NSAIDs to turn off that mechanism because you're creating that feedback loop of the chronic. And before you know it, you could have osteoporosis in your tailbone preventing walking altogether.
Do it now, right?
Well, not to scare tactic. Obviously, that's worst case scenario. But if it's preventable, then let's do what we can.
I just figured it was hereditary because my mom had 2 hip surgeries on one side for arthritis in the hip bone, and one on the other side. And her last surgery, the bone was so deteriorated they couldn't connect.
Do you know what type of arthritis?
Rheumatoid, I thought.
It was autoimmune,
Yes.
not osteo. Okay. Rheumatoid or autoimmune does have a higher genetic prevalence, but just because you have the gene doesn't mean that it has to be turned on.
In fact, both parents had it.
So you probably definitely have it. So yeah, and I was just talking to her about genetic testing, which you can get genetic testing to see how likely are you to have those things. Thank you for coming. Yeah. And so we just have to, no stone unturned, right? Because I don't want you taking 4 NSAIDs every day.
So when I go home and I don't take the NSAIDs, I'm not going to like cardiovascular.
You definitely want to titrate down.
Okay,
And
so-
as it's kind of like I say, it's a funny analogy, but the Indiana Jones, how he's like, you want to switch out, you want to take one as you switch the other.
Right.
So right now you have the NSAIDs in place doing something. So as you remove them, you want to replace it with something that's healthy to support the system versus degrade it, which is what the NSAIDs unfortunately doing now, right?
Yeah.
So we can't just take it off and let it be exposed and then put on. It's going to increase much more pain and make you much more uncomfortable and probably do a trigger effect to make you want to take 10 NSAIDs in a day, right? And that's what we definitely want to avoid. So how do we go from 4 to 3 to 2 to 1 to none, but you're on these cool, weird hippie enzymes? Or you're getting adjusted by a chiropractor, or you're getting laser therapy. It's pretty amazing some of the things that are out there these days. And again, people just say, well, there's no research, but that doesn't mean that it's not working. And you know, we do free 20-minute consults, and we have a chiropractor who takes most insurance, and she does laser therapy, and she does
it's
stretch
covered,
therapy,
too.
and it's covered by your policies. So I personally love her. We do a trade because I've had a lot of body issues and sports injuries, and so she's helped me exponentially. I highly recommend her. So
Last time I felt about a year and a half ago in the shower when we were camping. You gotta do your camping right. The deck that my husband built in our tent shower
Yeah.
was slippery from air conditioner. Slipped on it and fell and re-broke the tailbone again.
Oh,
And
no.
I had a doctor tell me